sometimes you see kids, and I see a little circuit in the scalp, and there's no hair. And the patient says, well, you're rubbing it, or not like that.
How old's the kid?
But he says it to you because the mother's thinking the kid's going to go bald.
How old's the kid?
Say an 8-year-old.
Okay. If it's not traumatic, which is a subset, and there's a fancy word for that, trichotillomania, where the kid's yanking the hair out of it. I've seen it once.
It happens, okay, but that,
Okay.
we have excluded that
Okay.
as best we can.
All right. There's a condition called alopecia areata, more pediatrics than adults. If it's limited to one patch, the patch will spontaneously come back. However, depends how much it bothers the kid, and depends on how many patches the kid gets. So you got 4 groups. You got solo patch, multiple patches. Now you got someone who's missing 80% of the hair. Now you got someone who has 0 hair. Fortunately, the 80% and the 100% is a very tiny subset. Okay, so we're talking single or multiple. It's inflammatory. It may burn itself out. There's nothing you're going to do that's going to prevent new patches. So basically, you're treating the patches as they're there. If the kid is 2-3, topical steroids, and don't do anything else. You just hope they penetrate. If it's an 8 to 10-year-old and it's 3, 4, 5 patches and it's upsetting him and the kid will sit still for it, then inject the steroid into the area.
And if you do that, how fast does that turn around?
I'll get the hair back in 3 to 6 months.
But it will come around.
Yeah, unless it's like unless it's a rare case where the kid's just going the other way.
But there are some situations where it doesn't come back?
There are some situations where it's really extensive. I've seen teenagers where they're missing 30 to 50%.
Is there any systemic disease that presents like that?
No. What happens is it's again in the autoimmune group, and theoretically thyroid is going to be associated with it, but it's like a 1 in 100 shot to find anything on the blood test. There isn't actually an effective treatment that's off-label. That's outside the U.S. There's a machine that's an electrical stimulant for hair loss, and I've seen it work on this where the medicines don't.
What? It's like a laser?
No, it's actually electricity. So it's a low-level electric current that's been designed to go down 1/4 of an inch exactly to the root of the hair, and it's approved in Canada and outside the United States as a hair-growing device. There is a diode laser out of Sweden that's not here yet, but this one has published literature on male pattern hair loss, female pattern hair loss, cancer-induced hair loss, and I've seen it work for areata. In fact, I had one teenager that the shots were ridiculous. I was giving the kid too many shots. I flipped him for the machine instead.
But usually, 99% of the time, it does get better.
The shots will work. The only issue is how mature is the kid who's going to sit still for all those needles.
Thank you very much.